Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us once again Dr. Aditya Agrawal. Dr. Agrawal is a leading pulmonologist, which is a respiratory physician, and he's attached to several large hospitals in Mumbai. He has his own clinic in South Mumbai, and he practices and he consults rather at the Bombay Hospital. He is extensively trained in respiratory diseases, both in India and the US. His special interests are difficult to treat cough, asthma, bronchitis, and lung fibrosis, and runs a specialized clinic for patients with chronic cough. He's a dedicated researcher and a peer influencer in the management of respiratory diseases. As those of you who have been here in the past would have met and consulted and asked questions to Dr. Agrawal. He has spoken on COVID care and respiratory diseases in the past. Today, we have invited him to speak on asthma and bronchitis care in the elderly. As you know, that this is a season when in not just cities like Mumbai, but across the country, there is a weather change and which causes various respiratory ailments. And perhaps this was the right time to request Dr. Agrawal to speak to us about asthma. So he's going to make a short presentation, and after which you can ask your questions. Just put in your question in the Q&A tab. Once again, as always, put in your age and gender so that he could give a more effective reply. Welcome to Health Live, Dr. Agrawal. How are you? I'm sorry, you are on mute. You are on mute, doctor.
Hi, thank you once again for inviting me. I'm thrilled actually to be back, and I'm actually happier to speak about something which I love doing day in, day out, which is treating chronic cough and asthma. So, when I speak about cough, what is cough and what is the process of coughing? So cough basically is trying to push out air from your lungs with certain amount of force. And why do you do that? You do that when something undesirable is going into your lungs, into your airways, which you need to expel out. And when you do that, the first thing that you do is the epiglottis, that is your throat here, shuts off so that there is no more communication of your trachea, that's the windpipe with the outside. Then the diaphragm, which is the muscle which separates your chest from the abdomen, squeezes to push the lung upwards and the lungs get compressed. When the lungs are compressed, the pressure, the air in the lungs gets compressed to increase the pressure. And this sudden release of the air from the lung causes the epiglottis, that is your throat, to open up and make a coughing sound. Now, when I speak about chronic cough, what do you mean by chronic cough? Now, chronic cough is a cough which is lasting for more than 6 weeks. And what are the most common causes of chronic cough? So the most common cause that we come across in our practice is chronic bronchitis, which has many types actually. Then you have the upper airway cough syndrome. I will demonstrate or tell you about each thing separately. Gastroesophageal reflux disease is one of the most common reasons for chronic cough or cough which lasts for a very long time. You have a special kind of asthma in which a patient will only be coughing with no complaints of breathlessness, and that's called the cough variant bronchial asthma. You have different forms of bronchial asthma, such as, or rather bronchitis, such as the non-asthmatic eosinophilic bronchitis. And then you may have lung damage, which is called bronchiectasis because of a variety of causes. Few uncommon causes of chronic cough include the use of angiotensin converting enzyme inhibitors, which are basically medicines for your blood pressure. Chronic cough may be caused because of cancer, that's lung cancer. It may be because of lung fibrosis, which may be due to an interstitial lung disease. And then the most rare cause is a psychogenic cause, which is basically a functional cause of coughing. Now, when I speak about chronic bronchitis, what do I mean by chronic bronchitis? Chronic bronchitis means you have been coughing for many months, where you are producing large quantities of phlegm for at least 2 months for the consecutive last 3 months, 3 years. Upper airway cough syndrome. So very often we may have cough because of rhinitis, that's nasal blockage, or you may have cough because of a little bit of postnasal drip. That means secretions from your nose are entering into your throat, or you may have a cough because of pharyngitis, that is a sore throat, tonsils also in younger people, in younger persons. This is the upper airway cough syndrome. Gastroesophageal reflux disease is a very important reason for chronic cough. And when I speak about gastroesophageal reflux disease, I mean to say it's basically what we commonly call as acidity, where you have, excuse me, where you have acid coming from your stomach through your food pipe, the esophagus, into your throat, and then it falls into your lungs into your airways, and this results in the airways going into a spasm suddenly, and which then tries to expel out all the acid which goes into the lung in the form of cough. Then you have these non-asthmatic eosinophilic bronchitis, which basically are a group of allergies which result in coughing, but which are not essentially asthma. Now, you may have bronchiectasis for a variety of reasons, and very often it is congenital. Patients who have had infections of the lungs, such as pneumonia or tuberculosis, may have lung damage, which is irreversible, which makes them have a cough forever. Another very common or rather uncommon cause is angiotensin converting enzyme inhibitors. These are blood pressure pills, and most often you will find such patients who have recently had a change of their blood pressure, who have recently had a change of their blood pressure pills coming to you with a cough. Then you have bronchogenic carcinoma, which is usually seen in patients who are chronic smokers. Chronic smokers have a very high incidence of developing lung cancer. However, we see a lot of lung cancer in non-smokers too. Then you have the interstitial lung disease, which is pulmonary fibrosis. The most common reason in the city of Bombay today will be exposure to pigeons, followed by exposure to fungus on the walls of the home, or because of damage to the walls because of water leakage. The other important cause of chronic cough are heart failure, where elderly patients who have had a history of bad heart disease start developing water, or rather start having collection of water around the lungs, or they have a collection of water around their feet, or they have swelling over their face and around their eyes. The reason why such patients cough is because water fills up in the lung and it results in them coughing. Now, when I speak about different types of cough, how can we understand what could be the cause of the cough? Because every cough has a different reason. Some patients have a honking cough which disappears during sleep, and such kind of cough is usually a habit cough or a psychogenic cough. With nocturnal, that means nighttime coughing, it is usually because of asthma or rhinosinusitis. That is basically bad sinusitis with rhinitis, that is runny nose. Nocturnal cough is also commonly found in patients with heart failure. So the reason why I speak about this in elderly is because heart failure is a very common phenomenon happening in the elderly, which is usually not picked up early. The patients will complain of tiredness, they may complain of weakness, they may complain of lack of energy, they may complain of a chronic cough which increases when they lie down. Exercise-related cough is usually found in patients with asthma and bronchitis. Stridorous breathing is when they have a noisy cough, and it is usually found in patients with a laryngeal obstruction, that means obstruction in the throat, or presence of a foreign body, which is usually a tooth or a denture in the elderly. And sometimes it can be because of pertussis. Elderly patients complaining of a cough which is spasmodic, which comes in bouts, and this usually happens with pertussis. You may have a kind of a cough called the staccato cough, commonly found in a bacterial infection by chlamydia, and you may have a barking or a brassy kind of a cough in laryngitis or tracheitis, where the windpipe is inflamed. And when you have patients coming with production of large quantities of yellow or green color phlegm, which is usually worse in the morning, it is usually because of chronic bronchitis or bronchitis, which is basically lung damage. Uh, should I go on to the second part before I take questions?
Yeah, you can do that.
Or should I just go on and finish off my little slides?
Yeah, you can finish off your slides and then we can take a question with that.
Excellent. So when I speak about asthma, another slide, sorry. Another thing which is very important in the elderly is chronic aspiration. We have often found you have elderly patients sitting at home and eating, and they start coughing the minute they start eating or drinking. And why does that happen? Normally, the air goes into the windpipe, which is in the front, as shown by the blue arrow. The black arrow shows the direction in which the food should pass through, and it should pass through to the food pipe or the esophagus, which is at the back. Very often what happens is the muscles in the neck do not have control over where the food is going, and this food may enter the trachea, that is the food pipe, which makes the patient choke, or they may have a chronic cough. A recent example is a patient with a muscle weakness disease who complained of a chronic cough for many, many years, but had no manifestation of muscle weakness in other limbs. All she had was a chronic cough. I happened to see her every morning in the hospital, and one fine day I managed to reach her only in the evening. And that's when I realized that, she had this weakness of her eyes, her eyelids were drooping, and she was extremely tired looking, though she had slept through the day. So now this patient had something called myasthenia gravis, in which she had weakness of the muscles of the neck, which prevented the coordination of the muscles to help the food go into the food pipe, and rather it went in the windpipe. This is the same disease which Mr. Amitabh Bachchan has, but it has no relation to him. Now, when I speak about asthma, what is asthma? Asthma is a reaction by the body to something which enters into the lung, which is undesirable. This reaction of the body is overtly excessive. It harms the body. So when you look at the left side, we see the normal insides of a breathing tube of a human body. It's nice and thin walled with a large amount of space available in the center for the air to pass through. My arrow is pointing there. There's a small, very tiny, thin, filmy layer of mucus around the lung to make the airway nice, moist and wet, such that the air passing through does not feel rough. But what happens is when something enters this airway, the airways react to protect themselves and they constrict. And when they constrict, the amount of space available in the center reduces, such that the amount of air passing through the lung reduces. The patient feels breathless. The second thing that happens is, because there is an undesirable substance entering inside the lung starts producing large quantities of mucus, which traps the particles which enter inside and then helps to bring it out in the form of a cough, in the form of phlegm. Now, whenever we injure ourselves, the first thing that happens is we have a swelling. Now, when the lungs are injured because of something foreign entering inside, there is a swelling of the walls of the lung. And you see the swollen lining here on the right hand side. And this results in even further reduction in the space available for the air to enter. Now, why does somebody wheeze? Just like for whistling, we need to pinch our mouth closed. Out here, when the airways are open, there is no sound when the air is passing through. But when airways are pinched, that means they are closed, there is a whistling sound which we call as wheezing. And very often you can hear yourself wheezing when you have sudden change in the air temperature, like when you go from summers to winters, or from monsoons to winters, and from winters to spring. Now, what are the common asthma symptoms? So most patients complain of difficulty breathing, but at no point of time would all the patients have the same set of symptoms. Somebody with asthma may complain of a cough. Somebody with very severe asthma symptoms, that means when they are choking, when they have no air going in, their blood starts, the amount of oxygen available in the blood starts reducing, and that's when they start turning blue. Patients complain of wheezing, which is basically they have a whistling sound from the lung. They may complain of tiredness and fatigue. They may complain of chest pain, headache, and even breathlessness. So when we complain of chest pain, the reason for chest pain is that the air which goes into the lung is unable to come out because the airways are all narrow. Now, this results in air being stuck inside the lung. And now, because the lungs are limited by the ribs, the lungs keep expanding with no air coming out. Now, the excessively filled lungs result in the lungs hitting against the chest wall and making the patient have that feeling of chest tightness. Headache in asthma is because of large quantities of carbon dioxide collecting in the blood. Now, when we speak about asthma, I explained to you that this is a reaction. And what is this reaction to? So there are a variety of triggers which can cause asthma symptoms. And these include pollen, smoking, both active and passive, exercise, mold. Mold is fungus in the home or outside. Infections are one of the most common triggers for asthma attacks in our country. Certain foods such as eggs, nuts, and fruits may cause allergies. Certain medicines cause asthma triggers, and the most common ones are beta blockers, which are blood pressure medicines in the elderly. So when somebody who's asthmatic and is recently diagnosed with high blood pressure, it's imperative that they tell their doctor about their asthma so that the doctor does not prescribe medicines which can worsen asthma. Another very common trigger for asthma is dust mite, which is ubiquitous, and most commonly patients who come with early morning sneezing, early morning cough have large quantities of dust mite in their bedroom or in their mattresses, which results in the asthma exacerbation. Now you have stress as a very important factor as a trigger for asthma, not to mention the pollution, which is ever increasing. Pet dander, that is pet hair, and pet excreta can sometimes result in asthma attacks, and cold air often triggers asthma. So when I speak about asthma management, what do I mean that somebody's asthma is controlled or not so well controlled? Now, when I have a patient with asthma or any breathlessness coming to me, my goals of achieving control over their disease would mean that their symptoms are taken care of. That means they have no breathlessness, no cough, no wheezing. And I would do that by the use of reliever medication. That means medicines which will help them control symptoms immediately. Then I will speak about activity limitation. So when I say that somebody's asthma is well controlled, it means that the person has no limitation in doing any activities. And most importantly, the lung function. That means their lung function test will be getting better when their asthma is better controlled. Now, treating asthma is not a point of care type of treatment. Now, when somebody with asthma comes, it's a chronic disease. That's something which we have to explain. Asthma, it's also important to reduce the future risk of asthma attacks. It is also important to ensure that there is no instability or worsening of the disease, no sudden attacks or exacerbations. Now, asthma may result in a chronic or long-term loss of lung function, which is usually seen in patients with COPD, that's chronic bronchitis. And while treating a patient with asthma, it's also important to make sure that we manage the side effects of medications, if any. Thank you. Thank you so much. I would encourage everybody to ask me a lot of questions.
And thank you, Dr. Agrawal, for this excellent presentation. You say that you want people to ask questions, and there are quite a few questions. We've got a lot of questions which have come in by mail, etc. But let me ask you a question which has been asked by Nimish Shah and two other people. One of them lives in Mumbai and says, and this is something that I was discussing with you earlier when I was inviting you for this, is that even Mumbai is facing very high AQI this year. The question which Nimish Shah asks is, how does one protect oneself from air pollution?
So when we speak about air pollution, we should not just speak about pollution on the outside, we should also speak about pollution on the inside. That means you have outdoor air pollution and indoor air pollution. Now you don't have much say in how you are going to control the outdoor air pollution, because it comes with a variety of factors. One, vehicular pollution. So obviously, if you are using a vehicle every day, or you have a vehicle where only one person is traveling, try pooling your vehicle, doing a carpool, or try using public transport if you can. Then when we speak about outdoor air pollution, very often we find that people are burning leaves or trees or branches to keep themselves warm, or to get rid of the fallen leaves in autumn. Avoid burning of stubble, avoid burning of these organic substances. That's how you control air pollution. When we speak about indoor air pollution, and this is actually much more important than what we spoke about the outdoor air pollution. Most often asthma attacks happen because of indoor air pollution, and one of the most common reasons is that we do not ventilate our homes well enough. Avoid keeping our homes cluttered, prevent dust from accumulating, and this dust, when aerosolized, that means when this dust is lifted up into the air when you're doing dusting or cleaning the home, this often results in attacks of bronchitis and asthma in anybody. Then very often while doing puja, we use incense sticks. Now it's the season of Christmas, and we are going to all end up lighting lots of candles all over our homes. Now this will add to indoor air pollution. Now we live in pretty sanitized environments, and we like our homes and offices smelling really nice. In the process, we use diffusers and multiple air fresheners. I would suggest we start avoiding these such things, because all of them are particulate matters. If you've ever seen an air freshener while spraying it, you can see the droplets which are sprayed into the air. And this droplet, when inhaled, will trigger your bronchitis or your cough. Then the other reasons for air pollution inside the home are, clutter, which is accumulating dust. Then other reasons for indoor air pollution are indoor plants, which usually produce flowers. Then another important reason for indoor pollution is use of carpets, which are dust attracting. So if you can reduce all these reasons, all these causes of your indoor air pollution, you'll do a good job. Now, how do you avoid this? So I've already explained how you can minimize these substances in the home or outside. But when you're stepping out, I would suggest you start wearing a good quality mask, because that's going to be a very protective thing for your airways. Stay well hydrated, because when you have drying of the mucosa, the dry air, when it enters the lung, it will trigger a cough, it will trigger bronchitis, and yeah, these are the most common things that you can, or the easiest things that you can do to prevent air pollution and to protect yourself from the pollution. The other thing is, if you really can't control much of your environment, then I think using an indoor air purifier works really well. Being an asthmatic myself, I very often use an air purifier. I have one in every room, just like what I have in my background here. So I tend to use air purifiers in every room to protect myself, especially during the winters.
Doctor, thanks. I think what you have in the background is a Dyson, right? Which is,
I have no brand affiliation, so.
no, I'm just saying it's one of the most premium thing. But there's a question from Chetan Mehra, who says it was an exceedingly lucid talk. Do you recommend any specific type of, as in, without naming a brand, is there any specific type of a air purifier that one must use?
No, hi, Mr. Mehra, how are you? I have spoken to him personally also, and no brands. At least on this forum, I won't be able to suggest brands. Though I have been a speaker for multiple brands of air purifiers in the past and in the future. But yes, what you see is what I use is what you see.
Right, but is there, okay, I wouldn't push you to recommend any brand, but is there something that one must look for in an air purifier while buying it? In terms of just, the type, what it should actually deliver.
So, the type of air purifier that you're purchasing should be something which can take care of the size of your room. So usually most air purifiers come for specific areas or volumes of air. So usually they range from 1000 to 3000 cubic feet. Then when you're using an air purifier, they should have a LED monitor which can tell you the air quality index of the room. The filter should be easy to clean or change, and they should be practical and easy to use and noise free.
Right. Thank you. Doctor, you mentioned about air fresheners, etc., that you should avoid. What about fragrances? As in, you do wear these fragrances, which are, most of them are sprays. There are some of these roll-ons, etc. But what would you recommend? And most of our viewers here, most of our readers would perhaps be using some fragrance or the other. What is your recommendation?
So, if you remember the story of why perfumes came into being, especially in the 19th century Europe, was because they would bathe once a year. We have the luxury of water and soap, tap water coming into your pipe water coming into our homes. Clean yourself. That would be the best way to avoid any ugly or unwanted fragrances or smells. When you want to use a fragrance, see what suits you. Very often, one person's fragrance may be another person's poison. So you will be able to identify which perfumes are okay with you and which aren't. Otherwise, if you can avoid using any form of fragrances, especially when they are aerosolized, which are sprayed. What you may actually use are the kind of perfumes which you roll onto your hands.
All right. So I think I would also take note of this. Doctor, you mentioned about dust mite. There are some people there's one person who has said that I am absolutely fine, but whenever there's dust, I manage to get uh, some problem or the other. There's wheezing and there's sinus that happens because of dust. What should I do?
So you have to identify the source of your dust, and dust is usually found everywhere. The kind of dust which I mean to say is the one where you have dust mite loitering everywhere. The most frequent site for dust mite accumulation is your mattress. So my recommendation to all my patients has always been change your linen every day if possible, wash it in hot water, sun dry it, so that you kill the dust mite. The other important thing is when you know you're allergic, you need to make sure your mattresses are covered with mattress protectors, which are little plastic sheets which are impermeable. Very often you should sun your mattresses so that the dust mite are killed by the effect of the sun. Now, if everything is not possible, then what you could probably do is once your linen is laid out for the night, take a hot steam iron and iron your linen. That will kill the dust mite. And that's a very, very effective way of reducing your early morning allergies, your early morning sneezing, your early morning breathlessness and wheezing. And my patients would swear by it now that, once they've started, the allergies have significantly reduced, and so have the need for doctor visits.
So you actually iron your mattress
Linen after it's laid out on the mattress.
every day.
Yes.
Doctor, you asked for questions, and now there are so many of them. I think we will.
Please ask. I would love to answer all of them.
All right. So I'm going to ask you some questions which are there. Um, there is an anonymous attendee who asks, can Dr. Agrawal shed some light on IPF and the treatment for it?
IPF. So now, when we speak about IPF, IPF is a very, very specific disease found usually in men over the age of 60 years. They are usually patients who have had some form of smoking in their life. They may have a history of GERD, that is acid reflux, but there is, by the very nature of the name, IPF stands for idiopathic pulmonary fibrosis. Idiopathic means we do not know the cause of this disease. And to date, we do not know what causes this disease, why there is fibrosis developing in the lung. And this is usually a diagnosis of exclusion. That means you try reasoning out why a person may have lung fibrosis. And when you can't find plausible reasons for his fibrosis, you term this as idiopathic pulmonary fibrosis. The second part of your question was what's the prognosis?
Right. And the treatment for it, yes.
So the treatment for pulmonary fibrosis is actually very specific, as in it depends upon what a patient needs. You may or may not be given an antifibrotic or a medicine which prevents progression of fibrosis. But to understand or to make you understand one very important thing is that this disease is progressive. It worsens with time. So you will have a steady deterioration or reduction in your lung function as you go along with the disease. Now, the other forms of treatment or something which will keep your quality of life intact or will prevent a rapid deterioration in your quality of life is that you eat well, by which I mean you have a high protein diet, you maintain your muscle mass, and for that you need to ensure that you are exercising in the right way. So you need to get proper lung rehabilitation or pulmonary rehabilitation. Another thing that your doctors would do is that they would vaccinate you, and this is extremely essential to prevent any secondary infection, because when you have a lung with fibrosis, you become much more vulnerable to infections which can suddenly deteriorate or worsen your illness. That's your lung fibrosis. When I speak about prognosis, the 5-year prognosis is pretty grim. And most patients, or rather the 5-year prognosis is about 10 to 12%.
Right. Thank you. There's a question from Mr. Sanjay Mehta, and you spoke about masks. His question is, often using masks with longer period, increasing the chances of asthma, which mask should one use? And even if it's not asthma, people do complain that it causes problems in breathing, uh, uh, especially in closed surroundings. Any recommendation of what masks should one have?
So ideally, a two-ply surgical mask should suffice. Or if it's very polluted, you may use an N95 mask. But I would still be comfortable using a two-ply surgical mask. Now, wearing mask does not worsen or increase your chances of getting asthma. In fact, it is protective. The reasons why somebody feels breathless or somebody feels breathless when they are wearing a mask is because they may very often be mouth or oral breathers. So if you have a nasal blockage, you will find that it is extremely difficult for you to wear a mask on that particular day. Now, after a year and a half of continuously wearing masks, the common person is understanding when and how they can make do without the mask. So if you have seen on days when you have a nasal blockage, you wouldn't be able to wear your mask. Now, yeah, I think that should suffice.
Right. There's a question from Mr. Suresh Ghate, who is 69. He suffers from chronic cold, sneezing, continuous nose flow for 2-3 hours at a stretch. What is it due to? And he says in the early morning and evenings it's more, and he requests for some treatment suggestions.
Uh, so, when you speak about it, from whatever little history I have, I haven't seen you, so I can't give you very specific medical advice here. But what I can tell you is that you do suffer from allergic rhinitis and probably some form of bronchitis. It will be very important that you make sure that your room, so your home is clutter free, your environment is clean, sanitized. You take care of everything that we have spoken of, things to avoid right now. See your doctor and allow him to examine you to see what's there in your nose, in your throat, and if you are wheezing, you may also require a lung function test to tell you if you have any specific type of lung function abnormality, which may require more specific therapy, such as inhalers of different types.
Right. Thank you. We have a question from Mr. K. Surunaya, who says, I'm 69. He gets cough early in the morning after getting up from the bed, and he spits out a sputum. It will stay for some time till I complete brushing my teeth, he says. At times while I'm doing my normal exercises. He says, I'm taking Telmikind 20 for 4 to 5 years, and now I take Evion 400. What is the remedy to stop this early morning cough?
So the reason why you wake up to a cough is, one, it could be bronchitis or asthma. Two, you probably have a nasal obstruction, which is causing phlegm to accumulate in your throat. And it is probably resulting from what is happening in your bed. There is something in your bed which is causing you allergies through the night. And this wakes you up early in the morning with a cough. You take some time to clear out all the phlegm, and it happens well before you brush your teeth. So you need to sort out your allergies, the reason, your triggers for your allergy, and then your cough will also reduce.
Right. We have a question from Mr. Sumerchan Jain, who says, I'm 80 and having a chronic patient of asthma. I have learned to live with it without any difficulty. My problem is I have pain in my chest when I walk, especially after taking food. It is not linked to the heart. I have been told by my pulmonologist that my pain is in the pleura. How can I control it?
Now, there are two completely sets of illnesses. When we speak about asthma, it's not your pleura which is involved at all. Your chest pain, which is because of your pleura, would be a kind of a pain which is stabbing in nature. You will have this sudden pain when you take a deep breath or when you're suddenly coughing. That's how you describe a pleural pain. But otherwise, when we speak about asthma patients having pain in the chest, The first thing I would think of is there's a lot of air trapping. That means there is a lot of air stuck inside the lung, which is unable to come out, and hence the chest tightness, especially when a patient comes to you saying, I feel heavy here, I feel choked, as if somebody's giving me a tight hug. That's how a patient with asthma usually describes. At the age of 80, I would be very inclined to ensure that there is no cardiac or no heart reason for your chest pain, especially when it comes on only when you are walking. So exertional chest pain, some most often is because of your cardiac reason and not respiratory.
Right, thank you. We have a question from Renuka Marwa, who says, Doctor, my mother is 83 years old and suffers from COPD since the last 20 years. She is continuously on oral steroids and also has to take Duolin plus Budicort nebulization twice a day. Despite that, she often experiences acute breathlessness. She feels weakness most of the time. We try to avoid exposure to pollutants, and she does pranayam also. How can I help her improve her breathing and generally her quality of life?
So when we speak about COPD and your mom has had COPD for 20 years, that's a fantastic way, I mean, she's done really well until now. Now, when you have COPD for that many years, you are very sure that somebody's lung functions are falling extremely quickly. Now, I mean, I cannot contradict your doctor, but I would have considered using longer acting bronchodilators as nebulizers. So what you're using, Duolin, is a short acting bronchodilator. The second important thing is when we speak about breathlessness, especially chronic breathlessness syndrome in the elderly with COPD, we need to look at how their muscles are functioning. So it's a perception. Breathlessness is a perception. To reduce the perception of breathlessness, the effort of breathing, you need to ensure that the muscles of breathing are strong. So getting a good physiotherapy, a good lung dedicated chest physiotherapist in as a part of the treating team is extremely important. You need to ensure that she's getting the right kind of diet where she's having a protein rich diet. The other important thing when you're treating somebody with COPD is how do you reduce the perception of breathlessness? So, when we speak about pharmacotherapy, that's what we have to do, which your doctor will best decide for you. But when I speak about non-pharmacological things, sometimes the mere act of having a blast of air on your face or keeping a table fan close to you makes you feel less breathless. And when somebody would bring a fan close to your mom, she would often say that her breathlessness is better. It is not increasing the amount of oxygen that is going into her lung, but what it is doing, it is increasing the perception or stimulating the receptors on the facial skin and making her feel less tired. That's how it helps. But very often in patients with chronic COPD, such as those who have very low or poor lung function, we may even consider the use of morphine in a very tiny dose if indicated. So there are many ways to reduce this perception of breathlessness in a patient with COPD. Not necessarily everything is pharmacological.
Right. We have a question from Mr. Rajesh Verma, who's a 70-year-old male. His question is, my chest physician is planning to try mepolizumab injection for my asthma. My absolute eosinophil count is 440. What is your advice? I'm taking DigiHealer inhaler twice a day and 10 mg Montelukast, 1 tablet at night.
Mr. Verma, it's an extremely difficult decision for any doctor to take when we are giving a biological therapy such as mepolizumab. Now, we tend to use this as a last therapy for patients who are doing very poorly with their asthma. Yes, we give mepolizumab in patients with eosinophilic asthma. It is how it is indicated or made for. When we are so I would have to look at all your lung functions, how bad your asthma has been, how often you have had attacks of asthma, uh, what are the ways that, are your medications correct? Is your use of inhaler correct? Is your technique of inhaler correct? It's a pretty detailed analysis which goes into choosing your biological therapy. Very often we would just not give mepolizumab for somebody who has asthma of a eosinophilic type unless it is causing him to be symptomatic and it causes you to be on an oral steroid for a very long time. You said you're on an oral steroid for a very long time?
He said that he has been having Digihaler inhaler twice a day and 10 mg uh, Montelukast, one tablet at night.
No, I think you would have to discuss this again with your doctor because you have still not maxed out on your pharmacotherapy, on your inhalers before we move to a mepolizumab. If you were somebody who has had several attacks of asthma in the last 1 year, yes, you are a very, very strong candidate for mepolizumab. Uh, Before I initiate such therapy, I usually do a very detailed analysis of my patient. And it's an extremely expensive therapy with each injection costing about 58,000 rupees. Um, so obviously money is also an important factor. Not everybody can afford it.
Thanks. Doctor, there was a question which a lady had asked about her 83-year-old mother. She says she's also taking geriphylin retard. Just an additional piece of information. Doctor, three more questions that we have. Some of these questions came in very early. One is from Mr. Brij Dugal. He's 79-year-old male. He says, whenever I drink water, I start burping excessively. And when I get up after sleep again, I burp. I don't have any problems with the stomach. It seems I'm taking air from outside and then throwing out. Is it correct?
The reason why you're burping is because when you're breathing, a lot of air, you're swallowing a lot of air. And this could be because of the kind of food that you eat, or it could be because you are not, your airways are constricting, and when air is trying to enter into the windpipe, a lot of it is going into the food pipe. So you would have to again go back to your doctor and see what could be the possible cause. If it is because if your burping is because of your food habits, then you may want to alter your food habits. Maybe you could exercise a little bit so that you have less bloating. Um, I hope that answers your question.
Right. Thank you. We have a question from Mr. Ram Tiwari, who says, "Is fibrosis of brands is the fibrosis brand of lungs curable?"
So fibrosis means irreparable damage. So it's, very often patients interchange the word fibrosis for any kind of interstitial lung disease. Not all interstitial lung disease are fibrotic in nature. Some interstitial lung disease are non-fibrotic or inflammatory, where there is only damage which is reversible. So when somebody does develop irreversible damage, that's fibrosis or scarring, and that's definitely not curable. The only way that you can cure this lung fibrosis is by having a lung transplantation, but that is a lengthy procedure.
Thank you. We have a question from Marjorie Fernandez. Her question is, as a 74-year-old, do I need to take medicines for interstitial lung disease throughout the year to prevent irreversible damage to the lungs? Or can the medicine be taken only when the symptoms of ILD appear? That is during the extreme Delhi winter only. The rest of the year, I seem to be fine.
No, that's not how it works. There are 200 different types of interstitial lung disease. Your lung expert, your pulmonologist will first have to define or identify your the kind of interstitial lung disease that you have. Now, depending upon your type of interstitial lung disease, the kind of medications will be prescribed to you. There are certain illnesses which are progressive, where you may not be able to taper off medicines. There are certain illnesses where you could taper off medicines. And there are certain kinds of interstitial lung disease, such as sarcoidosis, which usually do not require any treatment and require treatment only and only if you have worsening of symptoms or signs of disease progression. So unless your diagnosis is correct and accurate, no doctor would want to treat you.
Uh, Doctor, this is a question which perhaps concerns most people in cities. From Naveen Chandra Shetty, the harmful effects on pigeon droppings on lungs is known. Are there any harmful effects on lungs due to the presence of bats in the vicinity? And something that he's not asked, but what does one do about pigeon dropping? Because that's a very common thing around cities like Mumbai and Delhi, etc.
So, I had spoken about it about how we came about understanding that pigeon droppings cause lung scarring or lung fibrosis. Many, many moons ago, at the Trafalgar Square in London, there were these vendors selling grains so that tourists could buy those grains and feed it to the pigeons.
Yeah, the famous Dil To Pagal Hai scene, right? Not Dil To Pagal Hai, some movie, I forget. Dilwale Dulhaniya Le Jayenge.
Yes.
Right, where he feeds the pigeons.
So, but he's feeding the pigeons in Punjab, not at the Trafalgar Square, if I'm not mistaken. I'm sorry, I may be bad at movies, but jokes apart, what happened then was they found that these vendors had a unusually high chance of developing lung scarring or lung fibrosis. Since then, a lot of water has flown under the Thames, and now we have understood that we are seeing a very large number of patients, not just in urban cities, even tier 2 cities, tier 3 cities in India and across the world, with a medical condition called hypersensitivity pneumonitis. Earlier, we used to think that this disease only happens in people who are uh, breeding birds. So, it used to be called the bird fancier's disease. Now we see it more often in our cities where I come across one new case at least once every alternate day, if not every week. Now, the most common reason in Bombay is people feeding pigeons. By law, you're not allowed to feed pigeons, and there's a High Court ruling which says that if you are found to be feeding pigeons, you could actually be penalized. uh, if you are feeding pigeons, I would suggest you stop feeding pigeons. If you know anybody who's feeding pigeons, I would encourage you to stand up to them and educate them about the ill effects of feeding pigeons. Now, bats, yes, bat dropping can also result in it, but it is not the only. So there is no proven data on bat pigeon excreta or bat excreta causing this disease. However, there are a variety of reasons in our urban areas, especially with old buildings in South Bombay where we have water leakage. So if you have any, make sure you are getting it corrected at the earliest. Now, how do you prevent pigeon excreta around you? Stop feeding. Number one, the most important thing. Two, get nets put around your building so that there aren't any pigeons coming over. Three, when it is extremely, extremely worrisome, you may get something called pigeon repellers, which are little hooks which you can apply near your windowsill so that the birds don't come and sit there.
Right.
I hope
I
that
have
helps.
seen quite a few of them on air conditioners, which are just fixed on them. Doctor, we have a question from a lady who says that my friend's mother has been having acute cough since the last few days, and she's been advised to be on nebulizer, and that is causing her a fair amount of weakness. Uh, is there something that one should do because she's in Delhi?
I think you should go back and seek a consult with your doctor instead of having a talk here. Why? Because the patient may actually be feeling weak because of the underlying disease and not because of nebulizer. Because the nebulizer was never meant to make the person feel weak. Uh, the medication may cause certain side effects such as tremors. Now, or the patient may be having a cardiac side effect of the inhaler, where the patient may be having an irregular heart rate, which is causing her the weakness. it's going to be extremely difficult without seeing the patient to tell you what exactly is happening. The best person to help you here is your doctor.
Right, doctor. One last question. There are two questions about from people who want to take advice on what are the good breathing exercises and how to keep one's lungs healthy lifelong. Could you advise some breathing exercises that that one could advise?
The best exercise is walking, and I would encourage everybody to start moving, walk at least 10,000 steps a day. Intersperse your cardiometabolic exercises with a little bit of resistance training in the form of light weights. You may not necessarily lift heavy weights to build muscle, but what you could probably do is lift lighter weights and increase the repetition to increase your muscle strength.
Thank you very much, Dr. Agrawal, for your session today. We're almost touching 6 o'clock, and there are so many questions. There are a few questions which I have not asked, but they've been covered in your presentation. So, once again, thank you for being here for the fourth or fifth time as part of Health Live at Seniors Today. And for all of you here, we will be back once again. Next week, we have Dr. Mazda Turel, who's going to be talking about back care. He's a well-known spine surgeon and a neurosurgeon.